Hi, I'm Dr. Eti Ben-Shabbat, and in this video, I'd like to talk with you about the potential for recovery, for upper limb recovery, that someone has after a stroke. This is the fourth video in my stroke series, and the reason this topic is so important is because you have limited time with your patients or your clients. So you want to make sure you use the limited time you've got in the most optimal way you can, on one hand. And on the other hand, you don't want to waste time, precious time that you have with your patients and clients on treatment that wouldn't benefit them or that wouldn't give them as much benefit as a different treatment that you might choose. The second reason this is so important is because you want to be able to set realistic goals. There's no point giving someone an intensive upper limb rehab when in fact the functional gains they're going to get out of it are minimal. It means that A, I'm wasting my time, and B, I'm setting them up for false expectation and goals that are not realistic if you're thinking of the SMART goals. By the end of this video, you'll be able to determine who are the clients that will obtain functional recovery of the upper limb and which ones won't. You'll also be able to optimize the treatment time, the time that you have with your patients. And 3, you'll be able to set more realistic goals. In my previous video, I gave an example of someone who I saw had a stroke, and from the CT scans, I could see that he's going to have a limited functional recovery of the upper limb, and therefore I knew that I shouldn't be spending a lot of time doing intensive upper limb rehab for this person. The question is, how did I know that? The answer lies in the study of Professor Cathy Stinia from New Zealand. This was a very elegant study done a little while ago now, but what she did in that study, she followed people who had a stroke, a first ever stroke, who then received upper limb rehab, and she examined the question, who are the people that are going to recover and who are the people that won't recover? And what she found out was the people who had corticospinal integrity, or at least some integrity of the corticospinal tracts, were able to recover upper limb function, were able to recover a functional use of their upper limb. To examine the integrity of the corticospinal tracts, she used 2 methods. The first one was TMS, transcranial magnetic stimulation, in which she applied an external stimulus to the motor cortex, and if that produced movement, she knew that the corticospinal tracts are intact. And then the second method she used was diffusion tractography imaging, DTI. And in this technique, she basically studied the structure, the white matter tracts traveling from the motor cortex down to the spine to examine whether they're intact or whether they're damaged. So Professor Stinia showed that the corticospinal tract is the key, the integrity of the structure is the key to how much functional recovery the upper limb will have. Now, we don't have, most of us at least, don't have TMS or DTI techniques available to us in our clinics. But luckily, we can use brain imaging to examine this very question. What is the integrity of the corticospinal tracts? And to be able to do that, you basically examine the brain images to identify whether the lesion affects any part of the corticospinal tract as it travels through different points of the brain. If it doesn't affect the corticospinal tracts, then you know that this person is going to gain functional recovery of the upper limb. If it partially affects the corticospinal tracts, then you know that there'll be some recovery. But if a significant part of the corticospinal tract is affected by the lesion, then you know that this person is going to have very limited capacity for functional recovery of the upper limb. And therefore, there is no point investing yourself and themselves in an intensive upper limb rehab program because the gains will be minimal and they're not going to be functional. What does this mean to you as a rehab clinician? How is that going to change your clinical practice? Well, the first point is that you need to look at the lesion very, very carefully so that you can identify the integrity of the corticospinal tract. And if any part of the corticospinal tract is still preserved, then you know there is potential for recovery. It also means that you need to be very selective in who are the people you're choosing intensive upper limb rehab for. Because if someone had a complete disruption of the corticospinal tracts, they're unlikely to respond to your intensive upper limb rehab. And the final point I wanted to mention to you is that you need to be critical of studies that look into intensive upper limb treatment. Because if they included people that have complete disruption of the corticospinal tracts, they're not going to be able to demonstrate improvement in functional motor outcomes that the researchers may have chosen. Therefore, you want to pay attention to studies that looked into intensive upper limb rehab in people that either have preserved corticospinal tract or partially preserved corticospinal tract. So let's revisit the example from my last video where I was seeing someone who had a significant stroke. They had CTs, I looked at their brain images, and because I looked at the brain images, I was able to see that the corticospinal tracts were significantly affected. And because they were significantly affected, I knew that this person is not going to obtain functional recovery of the upper limb. And because of that, I did not spend my time delivering intensive upper limb rehab. Instead, I spent my time teaching them hand hygiene, how to care for the upper limb, how to preserve the movement of the upper limb, and also on tone management. In summary, in this video, we looked at how to determine who are the people who will obtain functional recovery of upper limb and who are the people who are not. We saw that the integrity of the corticospinal tract is vital to identifying the potential for recovery. We also looked at optimizing the treatment time by identifying how much of the corticospinal tract is affected, so that the time that you spend with your patient or with your client is as optimized as possible and you do not waste your time on treatments that are unlikely to produce results to the patient. Finally, we also talked about setting realistic goals. It's not fair to the patient or to yourself to spend all that time and effort in intensive upper limb rehab when in fact the likelihood of having any functional recovery is minimal. If you found this useful, I'll be grateful if you could share this video with other colleagues who may benefit from it. And if you want to learn more about brain imaging, subscribe to my YouTube channel or head to my website where you can find a lot more information about how to use brain imaging for rehab purposes, as well as long and short courses. I'll see you in the next video.